Before applying the horizontal drain tube attachment device, the patient's skin should be clean, dry, and free from oily residue. Remove the device from its sterile packaging, along with the illustrated step-by-step instructions. For this patient, who has a 24 French feeding tube, we'll cut a hole in the skin barrier large enough to accommodate the tube. We'll cut the hole on either side of the starter slit. For a tube with a smaller diameter, you can simply cut a cross slit in the barrier perpendicular to the starter slit. This cross slit provides an adequate opening for many small tubes. Where you cut the cross slit, or the positioning hole, depends on the flexibility of the tube and where on the patient's body the device will be placed. For flexible tubes, the positioning hole or cross slit is normally made toward the center of the barrier. For our patient, the tube is fairly inflexible, so we've cut the hole toward the outer edge of the barrier. Next, peel the release paper from the skin barrier, but leave the release paper on the tape border in place. Feed the tube through the starter slit to the positioning hole. Next, press the skin barrier into place and smooth out any wrinkles. Remove the release paper from the tape border and press the tape against the patient's skin. Bring the serrated strap over the tube and push the strap into the tube holder latch. Pull the strap through until it fits snugly around the tube. The strap should be tight enough to hold the tube securely, but not so tight as to cause occlusion of the tube. Now, simply fold the strap over and tuck it into the base of the mechanism. Do not cut the strap. You will need the extra length of strap when you remove the device. The device should stay in place for 5 to 7 days. While it is in place, follow all clinical protocols for placement, monitoring, and removal of percutaneous tubes. When it's time to remove the device, first pull out the extra length of strap. Then, squeeze the sides of the latch to release the strap. Pull the strap all the way back through the latch while continuing to squeeze the sides. Next, lift a corner of the microporous adhesive and gently press against the patient's skin to break the adhesive bond. Then, simply peel the tape and barrier from the patient's skin. The horizontal drain tube attachment device has been designed not only for patients, but also for healthcare professionals. The device can be positioned not only at the tube exit site, but also at a point distal to the exit site. To apply the device distally, make sure the patient's skin is clean, dry, and free from oily residue. Remove the release paper from the skin barrier and press the barrier into place. Be sure to position the device so that the tube holder is distal to the tube exit site. Next, remove the release paper from the tape border and press the tape against the patient's skin. Now, simply bring the serrated strap over the tube and push the strap into the tube holder. Pull the strap through until it fits snugly around the tube. Again, the strap should be tight enough to hold the tube securely, but not so tight as to occlude the tube. Finally, fold the strap over and tuck it into the base of the mechanism. Just as before, you will need the extra length of strap to remove the device, so do not cut the strap. When it's time to remove the device, follow the same procedure as before. Pull out the extra length of strap, squeeze the sides of the latch, and pull the strap all the way back through while continuing to squeeze the sides. Lift a corner of the microporous adhesive, then peel the tape and barrier from the patient's skin.